Well, it's time to resume. A number of members have gone over to the meeting of the Financial Affairs panel. Next, we have Alan and Mr. Raymond Wong. Paul reminded me a moment ago that when some questions were raised, other members were not present, and why did I allow the questions to be raised again? Well, members have the duty to raise questions. They may have a different angle, so I will be more relaxed about this. And that's why I allowed members to raise questions which have been raised by other members when they were absent. Paul is not here. Well, if you are not happy with the answer given, you can raise the questions again for follow-up action. Paul, I just told members why I allowed questions to be repeated by some other member. I said that that's the tradition of PAC. Maybe the answer was not agreeable. Well, if a member is not happy about the answer given to his question, he can certainly raise it again. But whether the question should be repeated by another member is another matter. Well, every member here to ask question to try to get an answer. So apart from Deputy Chairman and Chairman who are always here, there are members who may wish to go to the other meeting at the same held at the same time. So I allow this for the efficiency, for the sake of efficiency of conducting meetings. Mr. Alan LEUNG. Well, sometimes it's not a question of whether you can or whether you want, rather it's a question of whether you want to do it. I believe by spending another 10 minutes, I hope we can wrap up the remaining issues about Part 2, and we can then proceed to Part 3. Chairman, the taking of evidence is in relation to Part 2, and I always want the witnesses to understand my thoughts. This policy was implemented in 1957. The two salient requirements, free or low charge bears, as well as plowback of profits and surplus. After the policy was announced, there has been no modification, but the government is just paying lip service to this. They have talked about it in the most elaborate way, but little is done in terms of action. So I want to afford the last chance to the witnesses attending the hearing for this part to clarify certain things. Chairman, let's talk about Private Hospital F and the land grant. In paragraph 2.20, the land grant was done in 2010. If we look at the processes, well, some members have raised this, but this is also clear in this paragraph. The number of bears has increased from not less than 130 to not less than 300 bears, so there's a substantial increase. So the public would be able to get better and more appropriate hospital services. In 2.20b, it states, in 2009, when the FHB decided to exclude the 20% low charge beds requirement from the land grant, at the time, there was no new policy announced by the government. And according to the Director of Audit, the departure for the deviation from the 1981 requirements should have been done with EXCO's approval. That's just common sense. So the EXCO make a decision in 1957, and when you want to implement a new policy or you want to change the policy, you must go back to EXCO. FHB cannot do it or should not do it on its own. Under C, the 20% low charge batch requirements was difficult to enforce, but it was not reported to EXCO. So the administration, the executive, has reviewed this. For frontline people, as Dr. Ko has said, they are now trying to explore new directions. But before the EXCO's decision is changed, that is to say the announcements made in 1987 and 1981, before anything is decided by EXCO, you must follow those policies. Of course, you were not in the post back then. Maybe why was that the case? Was the CE reluctant to hear your views, or was EXCO too busy to deal with this? And also in paragraph 2.23b, the Director of Audit considers that you must clarify the legal position. Otherwise, you should comply with prevailing policies. And you must impose the requirements on the operation of Hospital F. And Dr. Ko also referred to certain things, which is in 2.22. And there's a new policy for the future grants of land for private hospitals. So I want to give the opportunity to Dr. Ko to explain why the procedure is as set out in paragraph 2.20. And in setting the new directions, because you're not following the 1957 the policy of asking for low charge beds and private or profits and surplus. And when do you expect EXCO to make a decision on the new policy? And then you would follow the new policy in granting land for private hospitals in the future. Because if you don't do that, and at the same time you are not imposing the two requirements on the land grants conditions, and when lease is up for renewal, you miss the opportunity. And even if private hospitals want to comply, there is no objective standard to follow. It's difficult for private hospitals to try to ensure compliance. So how can you change the perception of the public or this committee that the government is only paying lip service to this, but no concrete action is taken to follow through? Secretary, can you answer these questions related to policies and other issues? The first point is about our failure to revert to EXCO. I want to say that at the time, there was a policy review. In the course of that, we wanted to incorporate some flexibility in the conditions as a buffer. At that point, there was no new policies or policy proposals that we could take to EXCO. It was still in the course of consideration. So we did not revert to EXCO. Of course, I respect members' views on the failure. But it might be because there was no policy proposal that we could submit to EXCO. So we wanted to do something instead of having nothing in the conditions. Well, that's not the view of this committee. That was the view of the Audit Commission. Well, with hindsight, that's how it would look. I think if you ask me to explain, I would think that it was the way it was considered. If we say we decided at the time that we would not do it again, of course we could go to EXCO, but at that time we were considering new approaches, but there was no proposal that we could submit to EXCO. So as a transitional measure, we decided to have something flexible in terms of conditions. But of course, I agree with the Audit Commission, the Director of Audit's observation that it would have been better if we had reverted to EXCO. It would have been better. No, it would have been better. It's a must. I agree that we should have, we had to revert to EXCO. Yes, I agree that we had to revert to EXCO. Ellen, in answering other members' questions, the Secretary mentioned the January 2011 review from the land grant policy, land disposal policy. You want to have something to replace the low charge bears and proud bag requirements. Let's learn the lessons in charting our way forward. Let's try to see how we can provide remedy. So concerning the timetable you had in mind, and also the inclinations that you had in mind, perhaps you can elaborate and assure the public that with land premium forgone, we might be able to get something back. We are now putting up 2 sites for auction. It's a related issue. That reflects our new thinking. The way it's going to be disposed reflects our new thinking. It's hoped that through the land grant conditions, we may implement something that would address or better address the balance between the private and public healthcare sectors. At the end of this year and early next year, the 2 sites will be granted. So in the first half of next year, I would have to go to EXCO to discuss our new thinking. Concerning the timetable, if at the end of this year you are going to grant a site to a private hospital, then how come you would only go back to EXCO early next year? Well, you have to clarify that you must have all the conditions ready before you can grant the site. Well, actually, actually EXCO has approved the granting of the 2 sites. The Central Tendering Board would, in my estimations, have come to a conclusion at the end of this year or early next year. So I cannot intervene in the tendering process. So we'll look at the response, i.e. the result of the tendering exercise, and depending on the result, I will have to consider further whether the existing package of things would work. If the conditions are considered problematic, or we have new thinking, so no matter what, I would have to go to EXCO again in the first half of next year. Understood. But I don't think the Health Services Panel have had a chance to look at those conditions. But they were meeting on the 18th. I don't know how much will be disclosed on that occasion. I hope Dr. Koh, through this public hearing, you come to understand our concern of the PAC, the concern of the public actually. I hope you can come up with better arrangements to enhance transparency. Land is scarce, and how do you utilize land resources is a matter of concern to the public. I hope the Secretary's awareness about this can be heightened. And lastly, you said the X-Code has already approved the tendering conditions. In paragraph 2.22, you talk about the January 2010 new policy, such as the package charges, doctor's fee, maintenance fee, diagnostic procedures, surgical operations, lab tests, X-ray tests, drug and miscellaneous items. There will be some minimum requirements of all these. So I haven't had a chance to read the paper for the Health Services Panel for the 18th. So are all these covered in the tendering conditions as approved by X-Code? Are all these covered? Or do you have to prioritize the different items, and some would have to be a shelf for the time being? Well, actually, before the tendering exercise was conducted, the Health Services Panel have been informed of the conditions. So we're conducting the exercise on the basis of the conditions as stipulated.
I did not participate in the tender exercise. That is the committee. But once we have the result there, we will have to consider. That's what I meant. Well, the conditions that the EXCO and the panel were aware of has been incorporated in the tender exercise, and once we have the result, I will have to consider whether the offers were attractive enough, and whether they are feasible, and then I will have to go back to the Health Services Panel and the EXCO. So that's my understanding. Is my understanding correct? That is the meeting on the 18th. We're only talking about this report, so we don't have to follow up on the meeting on the 18th. 2.22 relates to a policy. That's why the Secretary talked about the tender process. I asked the question because in paragraph 2.23, under A, the audit made certain recommendations to the Department of Health and the Food and Health Bureau. And it include whether to replace the 2011 minimum requirements or instead of to use the 2011 minimum requirements to replace the provision of free or low-charge beds. And I would like to ask what has been done and what's the progress. Secretary, can you first reply to 2.23a? We will take reference from the 2 lots of land that is under the tender exercise, and the condition of the 2011 minimum requirements were included, and we will consider the results of the tender exercise. We will consider whether these conditions are suitable and whether they can be used to replace the provision of free or low-charge beds, or whether there is any need for any further adjustments. When will you share with us your latest position to the LEUNG? Sorry, Secretary, we're talking about Hospital F, not new leases. Please refer to paragraph 2.23. Can you first answer 2.23? Yes, 2.23 is Hospital F. So You first have to answer Hospital F before you answer about the way forward. Paragraph 2.23a relates only to Hospital F. To enforce the requirements related to Hospital F, that is, there is no cooperation of the low charge beds requirement. There is instead a flexible condition. My inclination is to have further discussion with Hospital F. There is flexibility in the condition, and we would implement the conditions known at that time, that is the 20% low charge beds. Yes, the old one, not the new one. So you will have to first answer in relation to Hospital F before you can tell us about what you're going to do in the future. You're subject to the restrictions of the agreement of the lease with Hospital F. Yes, although we have flexibility, but I'm inclined to discuss with the hospital to adopt 20%. Alan. Please go to 2.21. The audit quoted the new condition. Of course, the audit is very careful. It says that you should first seek legal advice. But it says that it is not necessarily the case that you are subject to the 20% requirement. But as the audit said, you will have to first get legal advice. But you should not you should not decide that it cannot be done at this stage, because we're talking about public benefit. You should maximize your room. Sorry, we've given Alan more time because just now we only had Mr. Raymond Wong in line. Oh, there are more members now. Mr. Raymond Wong. There are two recommendations in this part made by the Audit Commission. First is to ensure the decisions in relation to land grant will be enforced, and if there is any division, and depending on the situation, the approval of the EXCO should be sought. And I think that this is to make make remedy. There is something old and there is something new. For something old, you did not enforce the requirements in the lease. For new ones, you still have to enforce the two requirements, and you may have some new ideas. And in relation to direct grant to non-profit making organizations, you should seize the opportunity to impose suitable conditions. This is to make things right. But on these two fronts, that is, to make remedy and to make things right, you fail to show us that you have done anything that will reflect these two fronts. You may not agree with me. My question to you was, say, let's refer to 2.21, Table 3. In relation to 1967 LG2, at that time, the Department of Health could get in the way of the Governor in Council to go against the proposed percentage of free beds. And that was set in 1967. And then later, a different decision was made. Well, this is in the colonial period, but is it nothing to do with you? I don't think so. It is something to do with you. Because the audit recommends that the department should seize the opportunity to incorporate suitable conditions. And in relation to LG3 and 4 to Hospital C, they are in 1982 and 1981. It's difficult for us to understand why there is no provision of low charge beds in these leases. And in 1983, and in paragraph 2.5, it is very clearly set out in relation to provision of a low charge beds, that is no less than 20% of low charge beds, and the daily maintenance fee is should not exceed the class 3 of public hospitals. And also in relation, other hospital charges were not to exceed 50% of similar charges applied to second-class beds. This is something to do with you. During the investigation of the Audit Commission, recommendations were made that you should seize the opportunity to incorporate suitable requirements. And that is something that you haven't done. And in relation to LG7, well, you could explain to me why it wasn't done. So you need to let me elaborate, because we need to have a verbatim record. I am quite eloquent and easily comprehensible. LG7. This shows that the Lands Department and the DOH are passing the buck to each other, and the administration should clarify in the end who is to be held responsible. My next question, in relation to LG8 2010, the lease condition contained a provision of free or low charge beds, but it seems that the administration has adopted the standard in 1957. That is, the provision is to the satisfaction of the director of DOH. Why wasn't the standard of 1981 adopted, i.e., no less than 20% of low charge are to be low charge beds? Now, paragraph 2.12. Why didn't the director seize the opportunity to discuss with private hospitals for the incorporation of these requirements or compliance of the requirements? Director, can you explain one by one? Because it will be easier. Secretary, may I start with the last one, LG8? I've explained before. Well, the 20%, the figure was not incorporated. Instead, we have a more flexible condition, because at that time, a new idea was brewing. But we have yet to make a decision about exactly what the new condition was going to be. A responsible approach would be to put a flexible condition in place. LG7. Our understanding was that prior to 1997, for a period prior to 1997, leases that were due to expire during this period will be subject to a general policy to ensure smooth transition, so no additional conditions were to be incorporated. And then the one before, but that was 1987 was already covered. 1981. Indeed, the requirement was not put in place during the first approval of the private treaty grant. We could not find the documents, and there was a saying that documents were destroyed for no reason. Well, perhaps, let me put it this way: from the documents we can find, we cannot find the information. It's not the case that a certain document had gone missing. It's the case that for the information or the documents that we have retrieved, we cannot find the answer from those documents. And even if all the documents were there, there is no guarantee that we can find the answer among the different documents. Secretary, if that is what you say. Well, if you have the document, can you show us the document? Then it is easier for us to find the truth. You said there are documents. It's just that the documents don't give you the answer. It is very different from the documents being missing. And if there are documents, it's best to let us read it so that we can get a better understanding. So please provide us with the documents. Please continue. We fully understand that the majority of the cases are related to the colonial period, but LG2 is in 2010. In 2.19, it explained why the DOH deviated from the 1981 adjustments. It's on page 18. You said that is a flexible condition. Well, but, what do you mean by a flexible condition? Is it going to be 30%? Or is it going to be the package charge to enhance fees transparency? You did not give us a clear answer. D. Under paragraph 2.19 on page 18, the government was then in the process of reviewing the land policy, including the land grant conditions for private hospital development. The review might result in changes to the 20% low-charge beds requirement and the inclusion of other additional new conditions. The FHB further noticed during the review that practical difficulties were encountered in the implementation of the 20% low-charge beds requirement and in monitoring its compliance. It was the government's intention to abolish the 20% low-charge beds requirement in future land grants, which was to be replaced by other alternative requirements, such as package charge for the middle class, alongside other new conditions to ensure service quality, for example, through hospital accreditation on a continuous basis and price transparency. In reply to members' question that was touched on by the Secretary. In relation to the adequacies pointed out, you said the remedy are those set out in 2.19. I don't find that acceptable. As I said, you have to right the wrong. You have to make remedy to plug loopholes so that the undesirable situation will not continue. The number of beds has seen a significant increase from 130. So new conditions should be imposed on private hospitals if you think that these new conditions are feasible, but you ignore them. You only I don't even know whether the new conditions are being complied with. So why can't the conditions cannot be imposed on hospitals where irregularities are spotted? It can be written into the report. You were asking a question on 2.23. In reply to Mr. Leung's question, I think the Secretary has already answered, and he accepted the recommendations of the audit. Secretary, would you like to reply to Mr. Wong's questions? I don't think I can provide more detail than 2.19, but you will agree with the recommendations in 2.23. Well, what about the new conditions and the new policy and new measures? Do you have to seek the advice from the EXCO?
So, when they receive the bids, they will have to go to EXCO for advice and approval. Right, Paul? Now, just feel that, for example, in relation to LG 8, which was granted only in 2010, the Secretary said that a responsible approach would be to provide for flexibility. But then it seems that the flexibility would merely allow the private hospital to provide less than 20%, not more than 20%. So do you agree that although there is a policy, the policy is not followed? Although there are these requirements are not adopted? Now, I do not agree, Chairman. Now, members may have different views concerning the new requirement. You may have doubts concerning whether they can be implemented, whether they can serve our policy objective. But then I want to say that we gave the proposal very serious consideration. Now, in fact, at that time, we were merely considering and discussing the arrangements. And so I said that at the time, a responsible approach would be that we didn't want to put in the old conditions, but then the new conditions had not been finalized, and that was why I said a flexible arrangement was inserted. And then, of course, the original intention is that the flexibility would allow for both upward and downward movement. But of course, as to whether we'll be challenged if the flexibility is upward, then maybe we'll have to seek further advice. So you put in the flexible arrangement, and what did you do next? Did you seek legal advice? I'll ask the Department of Health to supplement. Now, before the flexible arrangement was in place, it was the 20% requirement, and so I think it's advisable to discuss with the hospitals whether they can provide a 20% free or low charge beds. I think the director can supplement. Director, concerning LG 8 low charge beds, according to the hospital, for 5P or over wards, the cost was bigger than the low charge, and in fact they are providing 30 to 50% discount for each hospital authority referrals. Now, for the hospital in Chunwan, they have 58 low-cost beds, 33 in medical and surgical wards, 25 in another ward. The utilization rate is from 51 to 68%. So that's the situation with Hospital F, the Chunwan Adventist Hospital. But we do accept the recommendations of the Director of Audit. We will see whether we can put in the 20% requirement for low charge beds, but we'll have to seek legal advice. I want to ask whether you are going to seek legal advice or whether you've sought legal advice already. Now, I'm not trying to be harsh, but then we are here to collect evidence. I think it's simple for you to tell us what you have done, what you haven't done, what you're going to do. So concerning this new requirement, provision of beds to the satisfaction of the DOH, have you sought legal advice? Have you communicated with the hospitals to make sure that the condition is enforceable? So, and then considering the figures you quoted, are they based on such a communication with the private hospital? Secretary, considering This is the work the hospital has done following communication between the hospital and the Department of Health. But of course, I do agree that more needs to be done. So after we've dealt with this report, we will formally seek legal advice, and we will formally put the request to the hospital that it should provide 20% free or low charge beds. So have you sought legal advice or professional advice, and have you had a review as to why it's so difficult to enforce the 20%? Secretary, I think this is the overall view, not merely a legal point. Now, concerning the 20% low charge beds, now the hospitals may tell us that the utilization rate is low, possibly because patients are not aware of the fact that there are these low-charge beds and they can apply for the use of these low-charge beds. And then the visiting doctors may not care too much about whether their patients need these beds, and so the doctors should remind them to apply for these beds. And so the utilization rate is on the low side. And so I think in future we have to work on other fronts, transparency of information, stepping up of publicity. And then for visiting doctors, previously, I said they were visiting doctors, but then because of that there was a misunderstanding of the Chinese term, and the media thought that I was talking about doctors going there for room rounds only or daily rounds only. Paul. Nothing has been done to rectify the situation. So looking ahead, looking forward, can you tell me what you can do under the grant or lease conditions? Or is it that our hands are tied, there is nothing we can add to the lease or the grant? So have you learned a lesson? I think, Chairman, this report shows us that some of the requirements have not been included in the lease. And so if we want to enforce such requirements, we can't enforce the requirement as a mandatory requirement. We can only try to have some negotiation with the hospitals. What about unjust enrichment? The premium was 0 or nil to $1,000. So in the eyes of the public, the government erred with regard to the drafting of the lease and the enforcing of the conditions. So what are you going to do? What can you do? Now let the two directors reply, because they are responsible for enforcing or implementing the policies. Now in fact, I think I and Mr. Poche are essentially making the same point. Now because the requirements are not in the lease, we can't act as if the requirements were in the lease. But still, we should try negotiating with the hospitals. But then, having the salient requirements in the lease and not having them in the lease are definitely two very different scenarios. But then, Director of Lands, you are the statutory authority to enforce the grant or lease conditions. So can you address the point made by Paul concerning the requirement to provide free or low charge beds? We require the hospital to provide us with figures on a regular basis. But of course, if the requirement is not in the lease, we can only negotiate with, say, Hospital F, LG8. Director of Audit is proposing that we should include the 20%. We'll have to have further discussion with the hospital. But then, as I have reported to members, at the moment, the hospital is providing low charge beds. But of course, the conditions are different from the conditions that apply to leases with the 20% requirement. Director of Lands. Now, if the lease doesn't contain the requirements, then of course a soft approach would be to have negotiations between the government and the grantee. And then in future, when they come forward for lease modifications because of some technical reasons, for example, parking spaces, relaxation of height restrictions, then we will, within the government, seize the opportunity to give reminders to the sponsoring bureau or department. But of course, it would very much depend on the outcome of the policy review, what conditions should be included in the lease. I don't know whether members are happy with the reply. I am not. I believe members of the public are not. Now, in fact, the land was granted to the grantee on the understanding that they would have to comply with the two salient requirements. So we're not proposing or adding new conditions. In fact, they have been benefiting from the government's omission. Now, I think you should tell them that there is this public outcry. But you are telling us that, oh, sorry, there was the omission. Nothing can be done. We'll do better next time. We'll see whether there is an opportunity for us to make amends. So when the opportunity comes up, we'll do that. Do you want to respond? Yes, Chairman. The Director of Lands is saying that she will seize all future opportunities to make amends. And I want to say that on our part, we will use administrative means to negotiate with them. But then having the requirements in the lease and not having them in the lease are really two different scenarios. Now, Paul, you are a lawyer. I believe you know very well that the lease is a contract, it's a contractual document, and you can't change it whenever you want to. But then, of course, there can be an administrative memorandum or what, but then the Director of Lands can't change the terms in the lease arbitrarily, and that's why the director mentioned a soft approach and a harder approach, right? Yes, Chairman, I want to say that we will continue to work based on the administrative approach. Now, when they renew the grant under CAP 165, there are only 3 conditions: accommodation, equipment, and manpower. And what we're talking about is outside the 3 factors or issues. So we have to honor the spirit of the contract. That's why we need to have the hospital's cooperation. We can't unilaterally dictate that the hospital has to do this or that. So in other words, you can't change the contract arbitrarily and unilaterally, but then you can do something by administrative means. You can rely on the stick approach. So I think he has already told us very clearly what he intends to do in future. Paul, I'm not being unfair. I'm not trying to make things difficult for Mr. Cole. I don't want you to think that I'm unfair. No. I just want to say that others who are laymen, as far as legal matters are concerned, may not understand. I just want to say that in fact, the Director of Audit has carried out the review. In fact, the problem was known to you as early as in 2010. So what have you done since then? And why haven't you grasped opportunities to make amends? And also, Chairman, the lease is only part of the whole transaction. I think your powers are not limited to those stipulated in the lease. In fact, there are implied conditions. You can take action. Now, so many years have lapsed. Just now, I talked about unjust enrichment, and that's a concept under the law of equity. I want to know whether you have explored these options. In other words, given an unfair situation, we should try to minimize the unfairness. Secretary, I've already said that I will, at a later stage, seek legal advice. In other words, legal advice has never been sought. In fact, I have said already that we have not sought legal advice on this matter. But Paul is asking you why nothing has been done, no legal advice has been sought since 2010. Now, Chairman, I, in fact, told members about the enforcement and implementation situation in cases where the salient requirements are in the leases. But Paul is talking about implied terms and also equitable laws of equity. So perhaps you can, we want to know whether you have sought legal advice on these possibilities or options, because the matter was known to you as early as in 2010. All right, can the Director of Lands answer this question? Chairman, concerning the two salient requirements, they are not in the leases. Can it be implied that in fact these requirements are in the lease or should have been in the lease? On the face of it, that would be difficult because we can't really enforce anything that's not in the lease. All right, that's all, Paul. Kenneth, I will have to draw a line. You'll be the last one, and then. And I'll give the floor to Ellen. Can we go to part 3? Kenneth, how many minutes do I have? You can go on for as long as you like because there is nobody else queuing up after you. So I'm trying my best, really. I want to ask a question about the facts. First of all, I wish to follow up on the point made by Mr. Porcher concerning unjust enrichment. Do these hospitals have to pay profits tax? Have they been paying profits tax all along? Are they under Section 88? Most of them do not need to pay profits tax. So, in fact, we're talking about double concessions. Now, they were granted land based on very favorable conditions, and then these hospitals have made profits, but then they do not need to pay profits tax. Now, I don't want to go on with regard to the lease conditions, whether the salient requirements are in the lease conditions or what, because I don't think I can get any result out of such questions. But then LG8, according to Mr. Cole, there are enforcement difficulties, and so he proposes that a more flexible arrangement be adopted in the future. In other words, the arrangement outlined in para 2.19D. Because one of the salient requirements is that the hospital should provide 20% low-charge beds. So when the hospital prepares the annual financial returns, can there be a segmented reporting? I believe the Director of Audit knows what this is about. Normal charge beds and then low charge beds. The financial statements for these two categories should be separated. Now if you can, I think you can require the hospital to do it, but the Bureau hasn't done it. All right, if you say you can't do it, and then you are saying that there should be package charge for the middle class and other measures to replace the 20% low charge beds. Now, I remember the Secretary telling us on the 30th of November that we could not impose a cap for the package charge because it was free market operation. And at that hearing, I asked Mr. Koh whether in license renewal or license issuing, he could require a private hospital to provide at least 20 or 30 package charges to cover common diseases. And he said maybe that could not be done because the situation in Hong Kong was different from the situation in other countries.
So what is covered by 2.19D that is actually some excuses that you are going to resort to. Secretary. We have imposed different conditions on the land grants of different hospitals. When we talk about package charges, we're talking about the future, including the two sites put up for tender for private hospitals. So in the land grants, we would impose such conditions, and such conditions will be enforced. If they fail to live up to this, they will not be able to win the bid. They have to promise us that they can do this before they can satisfy the Central Tendering Board. As for other hospitals where their land grants have the 20% low-cost beds requirement, if we want to do it differently, we're not doing it as a matter of enforcing the land grant. If we hope that these existing private hospitals, where their land grants do not have such a requirement for low charge beds, if we want them to do this, we can only do it through other administrative means. Mr. Leung, well, I'm not actually asking for the situation with hospitals without such conditions, because you are saying that even with those conditions, you have enforcement difficulties. How are you going to resolve such difficulties? And that is to say, since although the land grants provide for such conditions, I was asking whether they should have a segmented reporting for the two different categories of beds, normal charge beds vis-a-vis low charge beds. Would you be asking the private hospitals to do this, given that there is such a requirement in the land grant? Well, we can put forth reasonable requests and requirements concerning their financial reporting. Well, to make sure that under the two salient points, you have to make sure that they do certain things with regard to their surplus. Therefore, I asked you a question about your authority, your power. But that was that your power is derived from the two requirements promulgated back in 1957. Well, I agree that we do have the power to ask private hospitals to provide financial reports and the format of doing so. And I also agree that for segmented reporting, like what has been suggested, we will be able to better monitor whether the 20% low charge beds are properly utilized and the utilization rate. Sometimes the private hospital would tell us that it's not that they don't want to provide 20% low charge beds, but such beds have low utilization rates. So I try to explain that maybe doctors and patients are not very well informed about this, and there's a question of lack of proper information. I suggested a change to the financial reporting. Well, if the private hospitals do this, they would face certain pressure. They would make public the utilization rates of the two categories of beds. And now they just tell you what they want to tell you. The public will not know why the utilization rates are so low. Maybe they don't want to do any publicity. They don't want to inform the patients. And they will be used as high charge beds first. If there is a reporting requirement, then every year they have to tell people that how much income is derived from normal charge beds and how much from low charge beds. That's what I'm trying to achieve. Secretary, please look into the feasibility of doing this. Well, this is a suggestion by Mr. Leung. Please consider this in the light of the power you can exercise. One more point, Mr. Leung. The Secretary said that for new hospitals, there will be new commitments, new obligations that the grantee will have to comply. But the salient requirement is 20% low charge beds. Package charges are not what we want originally. These private hospitals have to show the social responsibilities to provide low-cost healthcare services to the public. That's the original intention of providing the land grant. And now you're saying that for new hospitals, all they have to do is to provide package charge or to comply with some loose conditions. So please consider, Dr. Ko, whether they should fulfill more requirements in offering package charge. For example, whether there should be a cap, or whether you are going to be satisfied if they can provide 20 to 30 package charges. Would you consider these suggestions? Well, I can only say that in considering a new policy, I'm going to take on board such suggestions in our consideration. Chairman, I'm not very happy with the answers, but I have nothing more to ask. Mr. Eleanor, on part 2, well, we'll draw a line after you have spoken. Up to this stage of taking evidence, I think in relation to part 2, this is about special land grant conditions. Having heard this far, for those who are following the meeting, I think they would agree that the government is saying something but doing something else. In 1957, it said that the land will be provided on a new or nominal premium for a premium of up to $1,000. The land will be granted to benefit in the form of free or low charge spares, and that the profits or surplus will be plowed back into the hospital's operation. From the evidence, we know that either you're not imposing the two special or salient requirements announced in 1957 in the land grants, or else you have failed to take sufficient remedial action even when there is an opportunity to do it. And Dr. Ko's bureau is of the view that in relation to the 1957 salient requirements, they may not be appropriate at this day and age, especially the 20% low charge beds as a requirement. But they have not told us how they are going to do to deal with the transitional period. To me, as a PAC member, my impression is that they are not taking action in concrete terms. They are just talking about things, and they have not taken appropriate remedial action when the opportunity arises. So before we wrap up part 2, let me say that that in relation to taking remedial action to deal with past mistakes or omissions, how can you assure us? How can you give us assurance that you are going to be more positive? Well, you haven't done everything required. You haven't sought legal advice. It seems that you are not very enthusiastic or proactive at this stage. If we stop at this stage, and I don't think the PAC would have difficulty in saying something nice about you. Well, don't frighten him. I've got a few minutes left. We're still on part 2. So perhaps, Secretary, please assure the PAC that you are not as laid back and passive as we have thought, that you are going to be more positive. And like the chairman said, we want to be fair to you. So please say something to assure us that you're going to be positive. Well, I can assure you that when we write the report, we will be very fair-minded. Well, we are asked to interpret what happened in the past, and we are also asked to elaborate on what we are going to do in the future. If you are talking about the future, we have a very positive and clear attitude. We are thinking about the new policies, and we are also going to monitor the tendering exercise for the 2 new sites. If necessary, we are going to go back to the EXCO, and we're going to explain what we are trying to do to the Health Services Panel. If the land grant conditions contain the 20% low charge bands clause, we'll certainly do this. For those without such a requirement, we'll try to achieve it through administrative means. Mr. Leung? All right, so perhaps we should pause here. On the 8th of December, we'll resume at 9 o'clock. I would like to take the opportunity to thank Jimmy. Well, Jimmy will retire on the 8th. So I wish you a happy retirement. You don't have to come back on the 8th. The Deputy Director will come instead. Thank you. Thank you, Chairman.
我哋內部會議4點半講返第3。
We'll have an internal meeting at 4:30.